So over the recent number of weeks, like three or so weeks, we've seen a gradual increase in the number of positives. Prior to us starting the reopening, we had gone down to about 10 new cases a day, and that did start creeping up to 20, and then sometimes it went up to 30, went down again. So that's kind of been creeping up slowly. But what happened most recently that has brought some attention is that up until recently, our hospitalizations remained low.
Okay.
But over the last weekend, we did see a huge increase. For example, on Friday, the number of cases in the hospital was 17, with 9 in the intensive care unit.
Okay.
And Monday, the census we got was 33 in the hospital and 14 in the intensive care unit. So that's about double.
So just over the weekend from Friday to Monday, it went from, you said 17 to 33?
Correct. Yes.
Wow, that's a lot. That's significant.
Yes, it
Yeah.
is. Um, and we do have a team that has been doing the contact investigation and contact tracing.
Mm-hmm.
And the factors we have found that have played into this is gatherings in homes for things like birthday parties, for funerals, and for Bible study groups. So that's what's contributing to this.
That was my next question for you. You just nailed it. Was I know it said in the thing, it said it was related to private gatherings of family and friends. We saw information that it came from two birthday parties, a church group, and a funeral. I'm wondering if that's correct.
That's correct, yes.
Okay, and I'm interested. Are there any cases connected to the protests or rallies going on?
It's too early to tell, but that is a question that we ask whenever we get a new case, is whether they have been to any events, any gatherings, and we have not had any indication. But it's still too early. It takes anywhere from 2 days to 14 days.
Okay, yeah, and since the protests are just going on, still currently going on, I'm wondering if do you think we could even, we're going to probably see more of an increase in COVID-19 cases because of those protests and rallies and those large groups of people gathering?
Well, definitely gatherings do increase the risk because you have a large number of people, especially if they're not maintaining the social distancing. Many of them were wearing face masks, so that does help. And also the fact that it was outside does help as well. But definitely bringing a large group of people together does increase the risk.
Is that something that you're concerned about?
We're definitely concerned, and we keep watching for that and for a lot of other reasons. We are continuing to reopen additional businesses, and people are getting around, so we are watching the numbers. What we are most concerned about is some of these cases where people are meeting in homes, because it's much harder to maintain the social distancing in the home. And as we have seen with this last week, it can lead to a number of additional cases, especially when you have individuals that have chronic conditions, which is what we're finding with the hospitalized cases, is many of them have diabetes, high blood pressure, heart disease, kidney disease, and that does put them at risk for severe disease.
I just find that really fascinating that what you guys are saying you're more concerned about is people gathering in, even smaller groups, but in a home rather than these huge protests going on outside with face masks. Is that correct?
We're concerned about both,
Yeah.
yes. But
Yeah.
right now, what we're seeing is with the home gatherings, and definitely we're continuing to watch and see what happens and encouraging people to get tested, because now we do have several venues where people can go in and get tested.
Great. And do you think that our hospitals are still prepared and doing well with this, or are you worried about as there is becoming more, cases and hospitalizations that we're not quite ready?
We have been tracking, and we maintain regular communication with the hospitals. And we know that they are very prepared. They have been able to handle the cases so far, and they still have capacity. So we continue to track that as well.
Great. And, the state's recommendation is right now they say it's increasing messaging, testing, workplace evaluation, as well as targeted outreach. I'm wondering if Sacramento County is standing by that. Is increasing messaging the solution, or is the county really considering easing back and putting back on more restrictions?
At this time, we continue to monitor the situation and we continue with our messaging, especially again for some of those gatherings that occur in homes because it's much harder to maintain the social distancing. The businesses have, many of them have been contacting us and asking for guidance and following the guidance that the state has provided because they want to do the right thing. They want to be able to make sure that when they open, that they do it right and are able to remain open. So they've been working really hard on that. And we do have inspectors that go to the different businesses to check and see what's going on. So I think that the businesses are trying really hard, but I think where we need to work harder is with the messaging to make sure that people don't relax too much. Because at one point we were giving the message, stay home, stay home. Then we said, yay, we've flattened the curve and now we can start reopening. But we also have to make sure we do that very slowly because we still want to protect those that are vulnerable.
Yeah, and going off of that, I know we were expecting to see some cases increase, and we were expecting to see, an increase in, hospitalizations because we are reopening. But is this more than you were expecting?
It's about the level that we were expecting, and that's actually when we were submitting our attestation to the state. That is what they expected us to prepare for, and they asked us to make sure that we had the resources to be able to handle that level.
Okay, and is there, any kind of, if it got even more increase than this, would that be when you would consider putting back on restrictions? Or it seems like, this is what you're expecting right now. I'm just wondering where that line is.
So it depends on multiple factors. So that's why it's so important to do the contact investigation and contact tracing. Because if we are able to identify very quickly where the cases are coming from, say if it was one workplace, and we're able to quickly go in and either shut down that workplace or offer testing and bring it under control quickly, then that will help. Also, the fact that what's happening with the hospitals, are the hospitals getting overwhelmed? Are they able to manage those cases? So those are some of the things that we are tracking. And there's no like magic number, but it's like we continue to track and see what factors are going on. And there's a team that has regular discussions, and we also discuss with the state before we make a decision to pull back.
Great, and that's actually my next story is on that contact tracing. So before I jump into those questions for you, I just have two more on the story today. I'm interested in what is the county currently telling people regarding gatherings? How many people should be allowed at an outdoor social distancing birthday party, let's say?
At this time, actually, there are not supposed to be any gatherings of any size. And you can see the reason why is because it does increase the risk. It's much harder in a home to maintain the social distancing. So at this time, we're not advising those types of gatherings.
Okay, great. And we had one question from one of our folks at the station. They said, "What exactly does it mean when they say the counties are being monitored? Does that go into that contact tracing, or can you kind of explain that?"
So the state is tracking our numbers. They get reports, daily reports of how many new cases we get. They also are tracking how many tests are being run in the county. They're also getting information about the hospitalizations, and if they see anything worrisome, they contact us right away. So they do have several indicators that they're looking at and certain levels of activity. So if any of the counties goes above a certain level within a period of say 3 days, then they will put that on the dashboard.
And just final question with this story is, what is, and I feel like you kind of did give a message with that kind of social gatherings thing. You said we're not encouraging those at this time. So I'm wondering if it's the same thing. I'm wondering what your message is to the community as these numbers, increase pretty dramatically for the hospitalizations.
We continue to remind people that we still have COVID-19 in the community. We have to be careful. We have to take measures to protect ourselves, minimize non-essential activities, especially for people who fit into those categories that can get severe disease, like those that have chronic diseases or the elderly. And so we really need to make sure that we're able to protect them. Then the measures that we can take for protection, one, of course, is stay home when you don't have to go outside. Stay away from gatherings as much as possible. Hand washing is important, and face covering as well.